People will ask you what the best way to do exercises is. And since you are going to be physical therapists, of course you know that the answer to their question is that it depends, right? It depends upon what you're trying to accomplish. So this is what we're going to talk about today. One of the questions that can be asked of you is what type of footwear is best. We talked a little bit about this before, but certain types of athletic footwear, especially those designed for running, have an upturn underneath the forefoot that makes it hard to get the force from the toes to the ground. So you can't utilize that torque in your strength training exercises. Now, you, of course, can do that if you're exercising barefooted. However, in some environments that might not be safe or it might be contrary to policy. So what is a good solution in those circumstances is to do what our Elizabeth does and wear shoes like this, where the toe box, the sole underneath the toe box lies flat on the ground and they have thin soles allowing you to get the torque not just of the ankle plantar flexors, but also the plantar flexors of toes to the ground. We're going to start this discussion by demonstrating the effects of small variations that you can make with exercises. So, for example, if you look at the fellow over on the left, he's got his heels elevated. And what having the heels elevated does is increase the external knee flexion moment by increasing the external plantar flexion moment. So if you want to increase the torque on the knees and really make this a quadriceps dependent exercise, you see the center of mass and how big the moment arm, the external moment arm on the knees is. If he wanted to increase that even more, he would have the weight behind him, right? Now, the woman over on the right, she has her forefeet elevated, and what that does is it causes an external knee extension moment, but look at what has happened to her hips. So she's doing deadlifts, which is a hip dominant exercise, but by elevating her forefeet and increasing the external knee extension moment, she's moved the center of mass even farther forward, so it's even more of a hip dominant exercise. We have been talking about for a few years how the hip abductors really work in the closed kinetic chain in normal human movement. So the woman here is standing balancing on one leg, and the small blue circle represents the frontal plane axis of her hip joint. So if we draw in the line of gravity from her center of mass, you can see that we have a reasonable external hip adduction moment. However, if we give her a kettlebell to hold in the opposite hand, so she's balancing on her right leg and holding the kettlebell in her left hand, not only does it actually increase the mass, but it also moves the center of mass over to the left, further away from the frontal plane hip joint axis onto right. So you're increasing that external hip adduction moment. So if you wanted to increase that and challenge those muscles more in the closed kinetic chain, that would be a good way to do it. But what if your patient is weak in those muscles and needs a little boost? Well, what you can do is give her that same kettlebell, but put it on the ipsilateral side. And that way, by moving the center of mass over, you've actually decreased the external torque that is being placed on the hip, on that right hip. So you've decreased the external hip adduction moment by putting the load on the ipsilateral side. Here is the young woman demonstrating a couple of variations of lunges. So in the picture on the left, her trunk is very upright, and here is her center of mass relative to her sagittal plane knee joint axis, which is the small blue circle on her knee. On the picture on the right, she's inclined her trunk forward. and there is her center of mass under this condition. So if you wanted to really emphasize the knee with a person with very strong knee muscles, then you might have them do it with a variation on the left side, so you have a much longer external moment arm of knee flexion. But if you wanted to decrease that knee load, you could have them lean forward, as you see on the right. So the young woman has a much shorter external moment arm of knee flexion and less of a quadriceps load. This slide is linked to the first of the group discussion questions that we're having about this particular topic. So here we see the same young woman with a kettlebell doing a shoulder press. And one of the questions that I'd like you to think about is what happens if she does this variation where she's holding the kettlebell above. And why might you do that? And what joint segments do you change the load in? Another thing that I'd like you to think about is the shoulder flexion exercise, which she's doing with a dumbbell in the series of pictures to the right. So here she's doing it with the elbow extended, and the question that I'd like you to think about is what happens if she does the exercise with the elbow flexed, and why might you use that therapeutically? Here is your friend James Harvey, who agreed to help me with this demonstration as well. I was really glad that James agreed to help me with this, because you know that James is a very hard worker, and I thought that it was really helpful to get him out of the darn building and get some fresh air and sunshine for a change. But he is doing 3 variations of deadlifting. First, with the bar in front of his feet. So you see there is the center of mass. With this variation, you have a very high external hip flexion moment and a smaller external knee flexion moment based upon where the center of mass is relative to the joints. Here's another variation. This time he's doing the same lift but with the weight behind his feet. So what he's done is move the external load to the rear. So the knee moment is higher and the hip moment is lower. Now, some of you may have used this very nifty device that James is using over on the right side, which is called a hex bar. And what that allows you to do is really distribute that external load evenly between the hips and the knees. The power of rapid eccentric muscle activation. That it is the kind of muscle activation, because it causes the highest musculotendinous tension, that is actually the best at causing some really helpful adaptive changes, such as muscle hypertrophy, some tendon hypertrophy, and also an increase of the number of sarcomeres in series, making the muscles more robust against injury in a couple of ways. So when we employ those exercises in such a way that you're eccentrically loading followed by a explosive concentric muscle contraction, that's called plyometric exercises. And I've got 3 plyometric exercises for you to consider. This is another group discussion question. I want you to think of what muscle groups you're using with each of these exercises. So I'm going to run each of these videos for just a minute. There's the first one. And she can rest. And here is James for the next one. Okay, great. And here is James again for the third one. I asked James to help me with are some whole body exercises using cables. So the third discussion group question that comes from this presentation is what exercises, what muscle groups are being engaged with these exercises that James is going to help me demonstrate right now.